So first, just want to say thank you for spending 30 minutes with us here on the last workday of February already. Cannot believe we're here. So today is, I think, our 47th coffee break, if that's correct. And we're going to take some time today to talk a little bit about distribution of health and wealth products. I'm excited to talk about specifically the professionals that sit in the distribution space, leveraging a little bit of data from our Greenwald's Insiders panel. So we've talked about our insiders before. We had a coffee break back in June 2025, and we had an opportunity to talk a little bit about the history of our insiders panel and why we chose to build that panel and our history of doing research with distribution professionals. And I've had numerous conversations with clients and partners over the years. And one constant of those conversations has been understanding the layers, the segments, the nuance that comes with understanding distribution, and specifically the people that work in distribution. So a lot of what we do and see as an organization is a matter of perspective. So as with most things, what you see depends on where you stand in a particular situation. So today we wanted to take a moment to look at some of the layers and the nuance of understanding the point of view of the distribution professionals themselves. That would be the panelists who join our insiders panel. And hoping to have some time at the end where we can maybe answer questions or as a group discuss some of your experiences and the nuances, layers that you see in the distribution space. So before I begin, I will caveat that I work primarily in the health space. And so while we do a lot of work in financial services and benefits and in healthcare, I'm going to try and keep today's conversation as high level as possible so it is applicable across the breadth and depth of health and wealth products and services that we Greenwald support, which is a little bit of a challenge and a stretch for me. So bear with me as we go. So let's talk about what distribution is to start. And I'll give a shout out to Eric, who helped run an internal training for us recently and created some of the heuristics that we're going to use today in today's conversation. So what is distribution, broadly speaking? At a very high level, it's the process that connects a manufacturer of a product or service with those people who might purchase it, the customer. In the middle are what our insiders are, the distribution professionals. They are the connectors. The way I think about them is they are responsible for connecting that product or service that is created by the manufacturer with that customer. They sell, they advise, or they place those products and services in the health and wealth space. If you think about distribution in terms of the 4 P's of marketing, the P that distribution is place. Where and how people will buy your product or service, or will you need other people or organizations to sell your product or service for you? So at a very high level, we're focusing mostly today on the purple part of this chart. So how does distribution happen at again, very high level? There are some variations that we can point to. So at the top, we have our manufacturers in blue. The bottom in green, we have our customers. And on the left-hand side, we have a direct model whereby the manufacturer of the product or service is going directly to the customer. There's nobody in between selling their product. In the middle, we have an example of a one-tier system where the manufacturer is using some sort of intermediary to reach its customers. And on the far right, we have a two-tier system showing a first tier intermediary and then a final tier intermediary to get to the product or service from the manufacturer down to the customer. We see these models in the health and wealth space. There are some products and services that are distributed in all different variations of these. We have some that might be more direct. We have others that might be more of a two-tier system or even further, multiple tiers. But really our focus is to unpack that purple piece here. Who are the intermediaries? What are they doing? Sort of what are the pieces and parts and layers, things that we can talk about, nuance in that group. In order to do that, we do need to briefly understand what we mean by manufacturer and customer. So starting on the left-hand side, let's talk a little bit about manufacturer. For us, we're really talking about health and wealth products and services. There is a long laundry list there on the screen, not comprehensive in any way, but this is really to give you some context about the kinds of products and services that we're talking about today and how distribution professionals fit in this gap between manufacturers and customers. On the right side in green, we talk about customers, and for the most part, we can sort of look at that into three buckets. We have the consumer, who might be the decision maker about that product or service, and the direct user. So if I am looking to buy a life policy for myself, I'm buying that and it is for me, I'm making that decision. We also might have a group or an employer who is the customer. So they are the decision maker and they might be the direct user of that particular product or service. So for example, maybe a general liability policy, a commercial property insurance policy, a workers' comp policy. They are making the decision about that product or service, and they are using that product or service. Of course, can't be quite that simple in the health and wealth space. So we often have a situation where the customer is a little bit more complicated. There's more layers there. So we have situations where the group or an employer might be the decision maker or the gatekeeper deciding on a particular product or service. Yet the consumer, employee, individual person is the direct user of the product or service. So obviously, group health insurance is a classic example of this, where the group or employer is the person or the entity, the customer making the decision for the most part about that product or service. And then the consumer is the actual person who is using that product or service. And then there's the added complexity here of who pays for the product or service. There are models where the group can pay for the product or service in its entirety. The consumer could pay for that product or service in its entirety, or there's shared payment. So that gives you some context of sort of the very upstream manufacturers of product and services and the customers that we are thinking about today. And now we'll spend the rest of the time talking about the middle piece of distribution professionals who help those manufacturers get those products and services shown on this slide on the left over to the customers on the right. So here's a little bit of what we're going to talk about today, and hopefully maybe everybody will want cake after this, but here's some of the layers we're going to unpack today in our conversation. When I think about those professionals that sit between the manufacturer at the top of our cake here and the customers at the bottom of our cake, there's lots of layers and ways in which we can segment and look at those particular professionals. We'll talk a little bit about this today, and we'll pull in some data from our insiders panel. But we will talk about product and service and the choices that distribution professionals make in terms of what products and services they, everything from the point of view of those insiders, are going to make an offer to their customers. We'll talk about licensing and the process by which those intermediaries are allowed, frankly, to sell those products and services. We'll talk a lot about use of intermediaries and all of the different layers and levels that might be involved in there for our distribution professionals. We'll talk about practice structure and how do these professionals choose to have their day-to-day business go. And then finally, we'll talk about role and title, which seems pretty obvious, but we want to put out that words really do matter. And sometimes the words that manufacturers use are a unique set of words versus what our distribution professionals might call themselves. So let's first talk product and service and everything from our distribution professional standpoint. So from a distribution professional standpoint, this is their job. This is their livelihood, and their personal income depends on their ability to connect the manufacturers of products and services with the customers of products and services. And so something that we see pretty clearly is that distribution professionals are fairly diversified in the products and services that they offer. They're offering a variety of categories of products and services, as we see here at the top in the donut charts. We see the majority of them are offering retirement products, investment solutions, health insurance products, and other insurance products like life, disability, long-term care, et cetera. We also see diversification in terms of who distribution professionals are targeting, who their customers are. And so we see not just a variety in the categories of products that they offer, but also the segments of customers to which they offer those products. So on average, we see about 3.5 segments, which is sort of a crosstab of the products and services they offer and the customers that they need. So really, we see a lot of diversification here, not a lot of really niche specialization, though that does happen. So in terms of licensing, it's an important aspect to being a distribution professional. Obviously, there's a lot of laws in terms of the universe of regulations around selling particular products and services in the health and wealth space. We know that most of our insiders are licensed in multiple areas. This is sort of a little taste of some of the licensing questions we know about our insiders. However, on top of just licensing, there's a lot more going on behind the scenes, which may change depending on the product or service that they're trying to sell. There are different words for this depending on the different industry or product or service, but in general, we see things like needing to go through state level licensing or registration. We see like on the health side, if you want to help customers purchase an insurance product on the exchange, you have to register and be an authorized broker for that exchange, whether that's state or federal. We see federal regulations like needing to file with the SEC or CMS if you want to be a Medicare seller. We see industry certifications or designations that are required or strongly encouraged in some cases, and that may need to be repeated annually, which means training, exams, paperwork. We see continuing education for a lot of these distribution professionals. And then I'm using the word here, appointment, which basically means a manufacturer has said, I'm allowed to sell their products, that I am knowledgeable enough to sell their products, and then I am able to place business with that particular carrier manufacturer. So there is a lot beyond just a license that a particular distribution professional holds. There are multiple layers there. And so we can see that it is really important to understand the nuance of the process by which distribution professionals can gain access to particular products and services to have them be within their business or their book of business. A good example is Medicare. So before selling a Medicare policy, a broker has to be state health insurance licensed. They have to pass an annual exam from AHIP or one of the equivalent certifications. They have to complete specific carrier training for each product that they sell. They might become appointed with the insurance carrier to sell that particular carrier's product. There's some CMS rules and paperwork that they need to adhere to. So it is not as simple as I've got my health insurance license and now I can start placing health insurance policies or selling health insurance policies. There's multiple layers within licensing that our distribution professionals have to go through. So we've talked about product and service, and we've talked about the layer of licensing. One of the most complicated layers of the distribution space is the use of intermediaries. And, you know, I think of this layer of the cake as being sort of really thick, that there's maybe multiple layers of cake in that one layer. So there's lots of ways in which a distribution professional can choose to connect up a manufacturer, that's the blue bar, with our customer in the green bar. So the best way to illustrate this is just examples. So starting with health insurance, we have the same broker here in the middle in purple, Abby. And Abby is operating in two different distribution structures simultaneously. So she is appointed or registered with a carrier, let's say United in this case. And she wants to help John Doe, her neighbor. John is retired. He hasn't quite reached Medicare eligibility age yet, but he needs to buy a personal policy to cover himself for health insurance. And so Abby is trying to help John buy his United Healthcare policy. And so Abby is able to place that business through a one-tier model. She's the intermediary and she's placing it with United. At the same time, Abby might be working with a producer or wholesaler to help Jane Smith find a group policy for her employees. And so she, Abby, may not be appointed with Blue Cross Blue Shield, with Cigna, with Kaiser, with Aetna, with the whole breadth of carriers that she might want to shop or place in front of Jane for her employees. And so Abby works and partners through a producer or wholesaler to shop that business, to place that business, and in some cases to help service Jane's group policy as time goes on. So one broker who is operating in two different distribution structures or the same kind of product, health insurance. So let's look at how this might play out in a financial landscape. And I think I'm not going to go super deep in this. Thank you, Eric, for providing this amazing example. But I think one of the first things to think about is we have one independent financial professional here in purple. And distribution channel that we often talk about with our clients is in the mind of the manufacturer of the product or service. It is from their point of view as to what they would label this person in purple. And it just essentially comes down to how they see the business coming through for them. The person in purple may or may not necessarily always know how the manufacturer might label them. So in this scenario, we have a financial professional in purple here who's placing 4 different types of products for our clients or customers. And so in this scenario, they're all working through an intermediary, but the way in which the manufacturer might classify that financial professional is that channel down the bottom. And they would call it something very different depending on how things played out. So this is just another layer of complexity in terms of understanding distribution professionals, because they are not operating in a single model, and they're not always operating in the same model for every product that they work within. So let's move to practice structure. Practice structure is important to understand for distribution professionals because it really helps us understand the context in which they might be making decisions about their products and licensing and the use of intermediaries. These all interrelate. And so we like to sort of understand a little bit about the practice structure. So we can see about half of our, insiders are whole or part owners of their firm. A good proportion of those are in smaller firm sizes. And we see compensation structure here. This is sort of averages. There's a lot of variation here, especially by kinds of distribution professionals and what they call themselves. And we know that some distribution professionals who work in group sales have different sort of approaches to targeting customers. So what does this mean, right? I think this is important to understand because it helps us get a sense of not only sort of how the professional is setting up their practice, but how that practice might evolve. And we do know from our data that smaller firms show lower income for the advisor themselves. We do know that newer advisor, broker, consultant, distribution professionals show lower personal incomes. They're just getting started. And so we do see a little bit of Darwinism happening, so to speak, and that the older the practice is, the more established it is, that tends to be a little bit larger, and it tends to be a little bit more profitable for our distribution professionals. Finally, let's talk a little bit about that last layer of role or title. And what we have found in talking to our insiders over the years is that sometimes they call themselves something different than what our clients, the manufacturers, might call them, and what their customer who is buying that product or service might call them. So I might sit down every 6 months with my financial advisor, that's the word I use as a customer, and talk about our investments and retirement accounts, and are we on track for savings for retirement? And that same person might help me purchase my personal life insurance policy. The manufacturer of that life insurance policy might call my financial advisors a different word. They might call them an agent, they might call them something else. But my financial advisor and me, the customer, might say they're a financial advisor. So when we look at what distribution professionals call themselves, that's the labels here on the left, and this is just a sampling. What we see is that there are some patterns in terms of the products and services and the customers that they are serving. So if I look at the top two bars here, financial advisor, financial planner, what jumps out at me is the two blue bars and the two teal bars. The first 4 bars are the bulk of where their income is coming from. And so what we're seeing is they're really heavily involved in investment and retirement services and products, mostly in the individual or retail space, some in the group or employer space. That's the G/E. We're not seeing them really involved in insurance or benefits, but there is a little bit there. When we look in contrast at your independent agents, the next to last bar, here we're seeing a lot of purple and green. This is health insurance and other insurance type products. And in fact, I'm seeing a lot of dark purple and dark green, which is individual retail health insurance or insurance products like life, disability, and so on. If I look at the consultants, they've got quite a different profile. What jumps out at me there is a lot of light colored boxes, which is a focus more on the group or employer space. and on the health insurance and benefit side for sure, but a little bit in the retirement and investment side. So words matter. I think the words that our distribution professionals use to describe themselves matter, because it is a signal for what kinds of products and services they are playing the connector role for, but it is not a one-to-one match. We can't always assume that our financial planners are only doing investment and retirement. They may have a small bit of other insurance products in their practice or their book of business. So with that, I wanted to sort of take a moment, leave us some little bit of time for some points of view, right? Because it's a matter of perspective. I think in terms of the distribution chain from manufacturers, the distribution professionals, and the customers, it is a matter of perspective. The woman on the top of the edge of the Grand Canyon has a very different view than the folks in the boat down on the river. And so I think this applies to distribution as well. So with that, we've got a couple of minutes. If anybody has thoughts, comments, things they want to share about some of the nuances that they've seen in the distribution space, we're happy to do that. And I can't see anyone. So if you have something, just feel free to unmute.
So Lisa, this is Eric Sondergeld. I just had a great presentation.
That is my secret weapon behind the scenes.
So I really like the part about the words matter and what we call people. So yeah. For the longest time, I've heard manufacturers refer to distribution professionals, as you're using the generic term, as producers, right? And the two things that strike me with that, one is, imagine someone is meeting someone, out in the wild for the first time, and they say, "So what do you do?" Say, "I'm a producer," right? They're going to think they make movies or something. But right. The other thing that I think is more important is that calling someone a producer is it's a very selfish perspective from the manufacturer, right? They're thinking about what this person does for them, when right. They should be thinking about what they can do for the financial professional, so that they can help them with their business and be more, have it be more of a two-way exchange and just they sell stuff for us.
Right.
And I wonder if there's a way we can help the industry rethink just how we talk about the people that are actually bringing in all of their business.
Right, and it's also it also limits sort of the end customer view as well. To your point, there's not a lot of people out there in the wild that would say, "Oh, I met with my producer and, he wants me to reallocate my retirement." No, that's not what they would refer to it as. So great comment. Thank you. Any other thoughts? We're always open for you all to reach out to us. We will be putting this coffee break along with all of our prior coffee breaks up on our hub. You can also find us on our website and LinkedIn. We've got a lot of good stuff coming out recently on LinkedIn. So please check that out. And thank you so much for just taking a few moments out of your day, and wishing everyone a great March as we stare that down around the corner.